The HFS report states, and again I quote, "Actual claims experience reflects higher enrollee costs than the traditional Medicaid population due to more untreated chronic conditions and higher hospital costs." The report indicates that Milliman believes the estimate for expanded health benefits for undocumented immigrant adults will total nearly $222 million in FY23 and nearly $990 million in FY24, which represents a $768 million increase, equaling 346% year over year. Undocumented immigrants are ineligible for any federal match. I'll repeat that. Undocumented immigrants are ineligible for any federal Medicaid match, resulting in the state GRF being used to pay for the entirety of services provided. The additional Medicaid pressure for these expansions is happening at the same time that the state is expected to lose $760 million in additional federal funding through the Enhanced Federal Medical Assistance Program, or FMAP, that was provided to the states during the pandemic. Several important state programs are still drastically underfunded and could greatly benefit from the $990 million in GRF that would go to HFS to continue to provide medical services to undocumented immigrants. The $990 million could be used to manage the systemic challenges within the Department of Children and Family Services that have contributed to rising costs, cases of child abuse, and deaths. The $990 million could be used to support services to the developmentally disabled, as outlined by the Guidehouse rate study commissioned by the Department of Human Services. The $990 million could be used to address the substantial workforce shortages within our nursing homes across the state. It could be used to increase funding available for the statewide database known as the Prioritization for Urgency of Need for Services, or the PUNS list, in an effort to increase the number of people served and the quality of resources available. You get my point. Unless drastic action is taken, the state of Illinois will spend nearly $1 billion of taxpayer funds on health care benefits for undocumented immigrants, adults in FY24. These ballooning enrollments and costs are simply unsustainable and will lead to the loss of funding for services for our most vulnerable citizens.